Namaste. Ayu-Chintana. Let's grow learning Ayurveda together. Details are the difference between the good stuff and great stuff. Details matter. It's worth waiting to get it right. And today I'm here with you with the episode 5. Let's explore. When you pay attention to detail, the big picture will take care of itself. So let's recall whatever we have discussed until now. Statistics on the incidence of colorectal cancer, assessment through basic principles, research articles on non-dietary origin, Ayurvedic explanations regarding the dietary as well as the non-dietary origin, importance of Nidra in preventing cancer, good dietary practices mark good health in the long run, detailed understanding of Matra Ahara and its relation to colorectal cancer, and critical analysis of srotas and rogas that occur due to Samana and Apana Vayu Tushti. In the previous episode, the last concept that we analyzed was srotas, their moola and srotodushti lakshana. We gave much importance to Annavaha srotas as well as Purishavaha srotas. If you check out my video on Annavaha srotas, you will understand in depth. One cue point we get here is to treat the colorectal cancer with Agni Bala Apeksha Ahara. So let's this be our first Chikitsa Sutra. Now let's discuss in details about Purishavaha Srotas. Its moola is Pakvashaya and Sthula Guda. So we need to take clarity on the anatomy and physiology of the area. One big thing that we are lacking in our understanding is of Purishadhara Kala, which is also called as Vidhara Kala or Maladhara Kala. Without any much presumptions, let's dive into the topic. So, what is the site of Purishadhara Kala? It is Antah Koshtha. That also includes Antra and Unduka. Again, going to the details, this does the division, the Vibhaga of Mutra and Purisha. This Purisha Vibhajana will become because of the Agni and Vayu involvement. Again, if we were to refer back to the symptoms of the colorectal cancer, we notice the major change is with the bowel habits. Unduka means that which is near to Guda. Above Unduka, Yakrit, etc. Koshtangas are present. So again, with the major change in the bowel habits, we also see there will be rectal bleeding or blood in the stool. But if it were to just conceal to this area, why would there be abdominal discomfort, cramps, weakness or fatigue, and unexplained weight loss? These symptoms will have an explanation if we were to dig more into the deeper aspects of Kala. At least as of today, modern research is not equipped enough to explain this complex phenomenon. We'll have to understand the mechanism that influences the consistency of the feces, that is, Purisha. Purisha is a Kitta. Kitta is post-Pakwa stage of Anna. Only Pakwa Anna can result. So, only the Pakwa Anna can result in the proper Purisha formation. So, if Anna is in the Ama stage, then Ama or incompletely formed stools itself gets evacuated. This can badly influence the Agni and Vayu. On a long run, Dushita Agni and Dushita Vayu influences the formation of Purisha. But how does this get influenced by Agni? Only two possible causes, right? If you think back, either variation from the Samana Vayu or Pittadhara Kala. Only two answers, where latter one is more apt in this case. That is, Panchami Purishadhara Sahi Antra Pakvashayashraya Tatra Undukastham Malam Vibhajati, whereas there is one more Kala called as Pittadhara Kala, Ya Chaturvidham Annapanam Amashayat Prachutam Pakvashayopasthitam Dharayati. So this explains the involvement of Pittadhara Kala and how it influences the Agni, and it in turn influences the formation of Purisha. So now let's understand Purisha. The first shloka to come up is Avashtambha Purishasya. That means to say, Avashtambha is Dharanam Avashtambho Deha Dharana Shakti. So one that imparts the capacity to sustain the body is Purisha. Shreshtham Karma Purishasya Smritam. So what is the utmost, the Shrestha function of Purisha? It is Avashtambha. This is from Ashtanga Hridaya Sutra Sthana 11th chapter and 5th shloka. Then one more reference is from Sushruta. Sushruta Sutra Sthana 15th chapter 5th shloka. Purisham upastambham vaivagni dharanam cha. So it is giving still more, one step higher clarity on the topic of Purisha. It is not just Avastambha, it causes the Avashtambha of the Sharira, plus what it does Vayu Agni Dharanam. So it is not just the Sharira Dharana, the components of the Sharira, namely the Vayu and Agni, are getting the stability because of the Purisha. Right? So this is one of the major utmost function of Purisha. So indirectly through the Anumana Pramana, we understand it should be the Purisha that gives the Bala to the Sharira. Right? So one more reference from Grahani chapter of Charaka, we get the answer more clearly. Agni adhishthanam annasya grahanad grahani mata nabhehe uparihi agni balena upashtabdho upabrumhita. There are two words here, upashtabdha, upabrumhita. So until now we explored two words. One is avashtambha from Ashtanga, upastambha from Sushruta. Now there are two more words, upashtabdha, upabrumhita from Charaka. So what it is trying to say is, apakvam dharayati annam pakvam srujati parshvatah durbalagni bala dushtotva tu amameva vimunchati. This explanation comes under the heading of Grahani. So what does Grahani do? Right? So upabrumhita iti agnina brumhana vyapara karanena sashakti krita. So one that gets the capacity to do the Brumhana Karya is Upabrumhana. So which gets this capacity is Grahani. So one which has the capacity to cause the Brumhana Vyapara in the body is that function is said to be Upabrumhana. Right? So Atra Pakshe Upastambha Sadharanyam Grahanya Aha. So this Upastambha is also the function of Grahani. Grahanyaha prakritam karma abhidaya vaikritam karmaha durbala ityadi. So what is the prakrita karma of Grahani? It is upashtabdha and upabrumhita. Upashtambha and upabrumhita. So upabrumhana. Then what is the vaikrita Grahani does? It does durbala agnina dushta to amameva vimunchati. So when the Grahani is in its proper normal physiology, what it does? It does the dharana of the apakva and does its pakva. It does the pachana of it. And what is the pachita anna is said to move to the next part of the digestive tract. Right? So, but when this Grahani itself is in the dushta stage, what happens now? Apakva anna will only be evacuated out of the body as apakva purisha. So, in order for the purisha to be formed properly, the anna has to go pachana properly. So, apakva anna will lead to apakva purisha, pakva anna will lead to pakva purisha. So, what does this have to say now? Purisha does dharana to the body. Thus, when purisha is not rightly formed, it leads to weight loss. Shakratvega, improper and incomplete evacuation. Further, it leads, and this explains the weight loss or fatigue and weakness that is presented as a symptom of colorectal cancer. Right? Now I think it makes more sense because with the symptoms explained from the modern science, they just say unexplained weight loss. But according to them, there is no explanation for it. But Ayurveda can clearly explain it. Why? Because we understand the basic principle behind Purisha. What is Purisha? But in the modern sense, what we say, fecal matter is a fecal matter. It is just has to be thrown out of the body. It doesn't have its main function as to bring in stability to the body, right? But according to Ayurveda, Purisha's main function is to bring stability to the body. And how it brings stability to the body? Because it influences and get influenced by Vayu and Agni. And this is how, when the Purisha is not getting properly formed or properly evacuated or too much evacuated from the body, this explains the weight loss, the fatigue and weakness. So, we have dealt with all the physiological variations relative to the early stages of presentation in the colorectal cancer. So, when the Shakritvega is deranged and there is incomplete evacuation, there is total imbalance of the Sharira Dharana. Hence, what modern science fails to explain is a well-established fact in Ayurveda. Just remember how fascinating this is. Directly, we are taught that cancer is Arbuda and nothing else. Now, you make conscious choice while understanding and analyzing variety of clinical presentations explained in modern science, ranging from the polyp, the adenomas, sarcomas, the polypoids, the primary tumor cell, the metastatic cancer cells, etc., and never make the mistake correlating directly to Arbuda. There is so much more to it, let alone the Arbuda Vyadhi. So now, taking hints from these explanations, can we say that our second and the third Chikitsa Sutra can be defined? First one, anyhow, we have established it as Agni Bala Apeksha Ahara. Second one would be Dravyas which are related and selected for proper Mala Vibhajana. Third one is to focus on the Annavaha and Purishavaha Strotas, its Karana, its Lakshana, its Chikitsa. And while we speak about the Chikitsa for Vit related Strotas, the variations, then the deviations from the normal physiology in the Purishavaha Strotas shall be treated as according to the Atisara Chikitsa. Further, let's understand the TNM cancer staging now. Primary tumor staging. T stands for tumor. So, it varies from Tx to T4b. This is the staging, and this needs very careful analysis with respect to Ayurveda. Primary tumor staging, clearly an anatomical view. This staging needs a very careful analysis, saying at the first the primary tumor cannot be assessed, and at the last the penetration or adhesion to the adjacent organs, penetration of the visceral peritoneal layer, all these can happen. So there's a range of symptoms that can be, not symptoms, probably range of anatomical variations that can be identified through primary tumor staging. So the understanding of the modern research provides the stages of tumor development can be seen in this image. Up to 75% of the colon cancers can be avoided with regular screening and other healthy behavior states. This is stated by the World Statistics. So, as colon cancer progresses to stage 3, in which the malignancy has spread to nearby lymph nodes, this is one more image depicting the changes that comes up with different stages of colorectal cancer. Changes in stool and bowel habits tend to become more apparent as the intestinal passage way further narrows and the tumor starts to grow into deeper layers of the intestinal tissues. As greatly it is depicted in this picture. What are the deeper layers in GIT then? There are 4 layers in GIT: mucosa, submucosa, muscularis, and serosa or fibrosa. There is slight difference in the anatomy of small intestine and large intestine. Though the whole of GIT has these 4 primary layers, but there are little variations from one part of the GIT to the other part of the GIT. Then, as you can see from the picture, there is intestinal villi in the small intestine area, where there are intestinal crypts, and there is absence of villi in the large intestine area. And when we compare the submucous part of the 4 layers of intestines, so in the submucosa of the small intestine we see glands. There are more glands in the submucosa of small intestine, while there are fewer glands in the submucosa of the large intestine. Whereas in the muscularis and as well as the serosal part, there is no much difference comparing to the small intestine and large intestine. There are menintic nerve plexus on both the sides. There is tunica muscularis externa on both the sides. But only variation is seen majorly in the submucosa and the mucosal area. That is, the epithelial area is different from the stomach lining to the small intestine lining to the large intestine lining. Then how to understand the Sukshma and the Sthula avayavas of the Purisha Vahasrotas and Grahani? Broadly, we can understand it as the first layer of Shleshmadhara Kala, the innermost. Then comes the Pittadhara Kala, then comes the Mamsadhara Kala, and intervened with it is Raktadhara Kala. Let's visualize them much better. We need not always take help from the modern anatomy to visualize this depth of knowledge. So, as we can see here, we are depicting the different layers through our understanding of Kala and its functions. Then, coming to the nodal status, we have a range of levels here. So, nodes cannot be assessed, that is NX to N2B, that is involvement of greater than or equal to 7 nodes. Then metastasis understanding and staging. Combined understanding of the stages of nodes and metastasis can be further viewed comprehensively under the concept of Srotodushti Prakara. So, as we all know, there are 4 kinds of Srotodushti: Atipravritti, Sangha, Vimarga Gamana, and Granthi. So, then comes a question, why tumor enlarges? We have staged it in the primary tumor staging, that in the initial stages it cannot be even assessed, but in the larger stage it apparently passes away with deeper layers of the intestines. So, how do we understand this? Comes a question, why tumor enlarges in the first place? Why cancer advances? Why it becomes more difficult for the prognosis with the advancing stages? It's because of the core concept of repeated engagement of 4 different ways of Srotodushti. I'm not kidding, but you see, no direct results then can appear on the web search if you type, what is the cause for the advancement of cancers? Then the way we search just provides vague answers, Like, for example, why is there an increase in cancer diagnosis? Or result 2 can be what contributes to greater increase in the cancer rate. So, even if you try finding the articles or published information, it's a big no. This great absence with the modern research is because there is lacking of basic principles, the core concepts. Only the Srotodushti Prakaras can explain it. It's a cycle with interval, continued wrongful dietary and lifestyle practices. One Srotodushti Prakara influences the other. Example, the Atipravritti can lead to Sangha or vice versa. This may lead to Granthi, then the Vimarga Gamana. But then, if proper Chikitsa is not received at this stage, or if the patient continues to follow all the previously explained etiologies, again, second cycle of Srotodushti occurs. So, with every stage, tumor size increases, symptoms severity increases, and prognosis becomes more and more difficult. So, now just sit back and give it a thought. Can cancer be completely understood just by staging it through TNM constraints? Don't you find it limiting? By now, at least we should all realize it is a lot more than just tumor size, nodal assessment, and metastasis. I'll take you through a spectacular explanation in Charaka Samhita Nidanasthana. We wouldn't have even thought of it as advancing stages, but yes, it is. Our acharyas were such aptas who have explained in details much more than what we can even imagine. Of course, Ayurveda is not just pratyaksha pramana. Roga has to be diagnosed utilizing all the parikshartha bhavas. This is the concept of nidanarthakara rogas. This wonderful shloka quoted as eko heturanekasya tathaikasyaika eva hi vyadhirekasya cha aneko bahunam bahavopi cha. Let's take one example here. That is ruksha etc. guna causing jvara etc. rogas. Ruksha adibiriti ruksha ushna lavanadibhi. So this comes to the ahara nidana. So yadyapi ruksham bahunam karanam. So ruksha is not a cause which is just limited to ajirna, just limited to the gulma, just limited to grahani. You see, there's a commonality between the causative factors. And every time ruksha steps in to the pathophysiology, it is bound to get the vata into the pradushana stage. So once this happens, okay, here the example is given as jvara etc. the rogas. So what are the other rogas that can happen? The jvara, rakta pitta, gulmadhyaha. So let's take the causative factor here as the ahara nidana and vihara nidana that we have already explained, and put it into different categories, and we arrive at a stage where it explains one roga leads to another, another roga leads to another, because all have same cause. So it can be the jvara, the gulma, the grahani samprapti are formed finally leading into atisara, arshas, arbuda stage or the presentation. So all can happen just with the cause of vatakara ahara and vihara nidana. Right? At every stage, cancer can exist here in jvara, gulma, grahani, atisara, arshas, etc. Every stage cancer can exist noticeably if we were observant to the minute variations of the physiology. So when we pay attention to the details, the big picture will take care of itself. So the explanation is not limited to hetu, but further acharyas explain. Analyzing the colorectal cancer through Ayurveda lens, one hetu leads to one dosha pradushana. Example is ruksha ahara and vihara lead to vatavritti. Then this dosha pradushana leads to one vyadhi. So ruksha ahara vihara leading to vishamagni and further vata kind of ajirna. So the same hetu leads to another vyadhi of similar presentation. If we were to say it as, if the hetu persists or roga presentation sets for longer duration in absence of right chikitsa, or if roga is gambhira or khavaigunya is more, or different srotodushti prakaras are manifesting on themselves all at once or in subsequent stages, it leads to a phenomenon called as vyadhi sankara. So vyadhi sankara finally occurs. That means to say many different vyadhis are presented at one single time, or many different symptoms like a syndromic approach can present at a single time. So it is not just about anatomical variation here or separately a physiological variation here. They coexist and they present at the same time interval. Hence, Samanya Ajirana Lakshana explains every other vyadhi, be it easy to cure, difficult to cure or non-curable even. So because Ayurveda always stands on the state of Agni, and that decides the Ayu, the life. So be it colorectal cancer or any of its variations, all start from Ajirna. So next comes with the background of PET scan saying, TNM staging constitutes more of an anatomical explanation. So what about the physiological variations that come with the colorectal cancer then? Right? This question is so valid. Correlating the anatomical variations with the clinical symptoms for staging of the cancer, this is how allopaths diagnose cancer. Let's read more accurate information from the official website of American Oncology Association, the National Cancer Institute. So what the website has to say. How cancer is diagnosed. So if you have a symptom or a screening test result that suggests cancer, your doctor will find out whether it is due to cancer or some other cause. There is no single test that can diagnose cancer, so your doctor may start by asking about your personal and family medical history and doing a physical exam. They may order lab tests, imaging tests, or other tests or procedures. You may also need a biopsy, which is often the only way to tell for sure if you have cancer. So what has happened with putting it as a cancer as a distinctive name or a diagnosis, it has filled in so much of fear in the minds of the people, not just the society but also in the doctor community. So the specific diagnosis as a cancer has become a scorpion, right? So it is stinging each one of us every day. Like, oh, this is cancer, this is very serious, and this might turn out to be incurable. These all things come up. But what is this diagnosis is all about? It is totally about the screening tests. And somewhere it is about little of information from the physical exam or from the family medical history. But this has no scope for dietary origin of cancer at all. And ahara sambhavam vastu rogasya ahara sambhavaha. This is what Ayurveda has to say. Like if the history, whatever the history that we are taking from the patient to arrive at a diagnosis is not at all focusing on how the patient is actually living and sustaining, what good of a diagnosis it is. Right? We Ayurveda people have to think about this, because our science is always teaching us, guiding us in such a right manner that we need to start considering the pariksha of the roga and the rogi from the nidana stage, where ahara nidana comes first, vihara nidana comes first, manasika nidana comes first, and not the screening test. Of course, I don't deny the fact that screening tests are required at a certain time. Not all the time. It should not become our primary assistance for the diagnosis. So now, do you relate why I asked the question? That is, it is just the TNM staging enough for cancer diagnosis, or is there a need for more holistic understanding? Yes, there is a need for holistic understanding. And how do we make this holistic understanding? Have you seen a spider web? How the spider builds its net, its web? How does it do? From the periphery to the core. So, if the core is getting wrong, we need to assess from all the peripheral things that lead to the core problem. If we just take out only few points that are superficially visible to us and are trying to make an understanding of it, trying to make a diagnosis of it, it remains incomplete. Let it be a junior doctor or a very senior doctor, if he or she is relying only on the screening test or the symptoms and correlating them just on a superficial level and trying to do a diagnosis without even taking a single small hold on the dietary factors, it will not make any sense. So what is this holistic understanding is all about? The whole of the web of the spider from the periphery to the core is made of a single material. That means to say, on a larger perspective, the spider web might look like an octagon. But the single strands which keep the octagon together is those single strands which are set in from the periphery to the core, to the middle of the spider web. So each strand is made up of the single material. That means to say here ahara is that one single material which is the common thing when the patient is in healthy state as well as when the patient is in the disease state. So unless and until we take care we take care of the food, the dietary habit of the person, as well as what were the wrongful dietary habits and the lifestyle practices that patient has done, we cannot assess we cannot arrive at the point of diagnosis. And how does these two things can vary? Because of the kala, because of the srotodushti, because of many other srotodushti prakaras, and when the etiologies continue, these srotodushtis become a cycle, a reoccurring phenomenon. So with all these, we need to come to the diagnosis. And it is not necessary that we diagnose it as cancer alone, because until this stage we have understood that there are many other things, just not the anatomical variation, right? So how is a cancer diagnosis made? If they were to consider only the physiological symptoms, saying the rectal bleeding, or there is discomfort in the abdomen, there is unexplained weight loss, just alone this cannot define them the cancer diagnosis. Only when they took the PET scan and did the TNM staging, that means to say they gave more importance to the anatomical variation and they are arriving at the diagnosis of cancer. We need not do that. We need not put it the label as cancer. Why don't we consider the primary stages of Mandagni, Vishamagni, Ajirna, the different stages of Ajirna, the Gulma presentation, the Grahani presentation, Arsha, Atisara. There is no need for us to say that it is Arbuda directly correlating as cancer. No, there is no need at all. Because we see the rectal bleeding in Arshas, we see the rectal bleeding in Atisara, we see the discomfort, the passing of gas, and there is so much of pain in the Grahani as well, in Gulma as well. And when there is improper evacuation of the Purisha, this is an explanation which is given in Gulma. Is it not that? Why should we label it as cancer and put it as correlating, okay, cancer and its correlation in Ayurveda is Arbuda? No, this is not needed. Why don't we give much emphasis on the basic principles? The basic principles that are helping us to gain much more clarity on the understanding, analysis and diagnosis. It very much helps us to come at the diagnosis, right? So we can treat the cancer presentations just like the amatravat ahara bhojana leading to some lakshana. We can treat it as grahani. Because people are out there, Ayurveda doctors out there practicing a very rightful way of Ayurveda, treating these cancers with the help of Ayurveda explanations, with the help of Ayurveda understanding. Okay. One more proof for the limited understanding of the modern science. This is an example, a web capture from the Cytomen Cancer Center saying, lifestyle can have a huge influence on the risk of cancer overall, but they don't know what are all the lifestyle changes that can influence. Further, they say not all cancers though have known lifestyle components. It is, they are not aware of it. Ayurveda can give you many different examples. It has well established the facts from the Samana Vayu and Apana Vayu about different lifestyle components leading to cancers. But what they say? Not all cancers though have known lifestyle components. They are still in the time of research. They have not yet arrived. Outlined below are the 12 more common cancers. So they were speaking about the breast cancer, cervical cancer, ovarian cancer and all such. So they have also given some of the healthy behaviors that can bring the patient back to the normal healthy state, they say. But it cannot happen like that, because whatever they have listed out is not at all near to that kind of a pinpointed etiologies that are mentioned in Ayurveda. So finally, I'll try to give you a complete picture of our understanding till now. So let's try following and improvising this as a diagnostic tool. So what I am to say here at the end point is, Ahara and Vihara Nidana. Observe the Purva Rupa with the Samanya Ajirana Lakshanas. And one more is from Amatra Ahara Sevana leading directly to the Lakshanas like Atisara. These two together, so then focus on the Sthana Samshraya correlating with the Agni Dushti and involvement of Samana Vayu and Apana Vayu. Understand the Sroto Dushti and the involvement of Kala. Severe Dushti involving all the doshas, and further the continued Nidana Sevana or Apatya or Abheshaja. So there is one point we need to consider here very much. Involvement of multiple Srotas at a time. Inspect for the Vrana Shopha and Antra Vidradi Lakshanas as well. More the cycles of Sroto Dushti involving the different Prakara. Finally, there is severe Rakta and Mamsa Dushti. Sangha becomes more and more, giving way for Granthi or Arbuda formation. So this is how the complete picture can be. It is not at the stage 1, it is Arbuda. No, it is just a presentation. It is just a final way of presentation, like advanced stage of presentation. So just remember, it is a kind of presentation, and in it whole is not cancer. Then Bheshaja, Shodhana, Kshara, Rakta Mokshana, Agni Prayoga, main focus is to uplift the status of Agni. So this shall be our Chikitsa Sutra. So finally it reaches the stage of Krichra Sadhya, if not the Chikitsa is done properly, and finally it is Asadhya. So what are we observing today? So when the cancer starts, if it is early stage, they would have given some medicines, and early stage radiotherapy or chemotherapy would be done. So it will subside for momentarily, like about another 5 or 10 years, they would have told the patient it might recur. Most of the cases it recurs and the metastasis sets in. And finally, the second stage, the third stage of treatment plans would be more and more radiotherapy or chemotherapy, or if the patient is he or she is indicated for surgery, and they do it. But if the surgery is done at the first stage only, what grade of a sinful act it would be, because what the patient needed there was to uplift the Agni. If the Agni was uplifted, the body might have healed up on its own and would have just avoided the further manifestations of the Sroto Dushti. But what we are doing, we are actually causing an Abhigata to the healthy cell, and of course to the cancerous cell, right? So there are some wrongful doings which are done at an earlier stage, which gives no place for the person to recover from then on. So the future starts today, not tomorrow. Seize the day, then let it go. Most precious resource we all have is time. Of course, it's a conscious and combined effort to realize the potential of Ayurveda yet again. Great things take time for the world to understand. For more content, keep watching Ayu-Chintana. Let's grow learning Ayurveda together. Thank you.